Welcome to this explainer. Today, we're diving into a massive paradigm shift, brought to life in our signature anime style featuring Dr. T in his white coat and the MicroSpine crew. We are setting the stage to completely demystify spine surgery for older adults, and we're going to replace all those outdated myths with cutting-edge medical science. So let's just get right into it. It's the question that sits heavy on the minds of so many patients and their families. Are you ever simply too old for spine surgery? For decades, there was this widespread fear that just having a high chronological age, say being in your 80s or 90s, automatically disqualified you from safe surgical care. But well, modern medicine has completely flipped that script. To understand why, we've got to look at the elite level of expertise driving this change. Dr. T is dual fellowship trained at two of the most prestigious institutions in the world, Stanford for neurosurgical spine and the Texas Back Institute for orthopedic spine. Having this crazy crossover expertise in both the nerves and the bones means surgeons like Dr. T can look at a senior patient's spine with a highly advanced, totally comprehensive toolkit. Here's our quick roadmap for today. First, age is just a number. Second, the frailty factor. Third, real outcomes for seniors. Fourth, endoscopic surgical innovations. And fifth, the awake surgery revolution. Let's go.
Part 1, age is just a number. Welcome to the new reality of spinal health.
The crucial point here is that we absolutely have to separate chronological age, the actual number of years you've lived on a calendar, from physiological age, which is your true biological reserve and organ function. The research explicitly tells us that chronological age is a highly heterogeneous process. In plain English, two 80-year-olds can have wildly different bodies. Age alone just completely fails to reflect a patient's true capacity for recovery.
Moving right along to Part 2, the frailty factor, measuring biological vulnerability.
Now this is where things get really fascinating. Modern spine surgeons don't just ask for your birth certificate anymore, they evaluate your biological vulnerability. They do this by looking at a deficit accumulation model, which is basically just tracking the total number of physiological deficits a patient has gathered over time. Preoperative frailty is an independent, highly robust predictor of how well a surgery will go. It's vastly superior to just looking at a patient's age.
When you actually look at the clinical outcomes, the reality becomes so clear. A highly fit 85-year-old with good biological reserve, they might tolerate complex spinal surgery exceptionally well. On the flip side, a severely frail 65-year-old actually faces much higher risks. It's all about the engine inside, not the model year. Which brings us to Part 3. Real outcomes for seniors. Let's let the data tell the story.
77%. That is the incredible proportion of patients over 70 who see meaningful functional improvement even after complex, multi-level spinal fusions. That's a massive restoration of quality of life.
And get a load of this next number. 95.1%. Patients in their 80s who undergo spinal stenosis decompression have a 95.1% survival rate a full year after surgery. The long-term success is just staggering, and it completely validates the safety of these procedures.
But hey, you might be thinking, what if I'm in my 90s? Well, researchers compared folks in their 90s to those in their 80s, and their recovery rates are practically neck and neck. We're talking a 33.6% recovery rate for patients in their 90s versus 38.1% for those in their 80s. Even in your 90s, you can experience highly meaningful postoperative outcomes.
Now, we absolutely want to transparently demystify the risks too, because they do exist. The very old geriatric cohort, those over 80, they do face a higher overall adverse event rate of about 20.1% compared to 8.1% in the younger geriatric group. But contextualize this. Surgical treatment reverses walking disorders, prevents deep vein thrombosis from immobility, and allows patients to actually re-engage in life. Reclaiming that mobility often makes this calculated functional trade-off incredibly worthwhile.
All right, Part 4, endoscopic surgical innovations. Tiny incisions, big impact.
Instead of those massive, scary open incisions from the past, surgeons now utilize full endoscopic spine surgery. Basically, they slip a tiny camera-guided endoscope through a very small incision. This gives the surgeon high-definition visualization to safely remove migrated disc material, all while beautifully preserving the body's natural tissue.
And these techniques directly address the common fear elderly patients have about losing their independence. We're talking about dramatically reduced blood loss, minimal muscle damage, needing far less postoperative pain medication, and a much quicker return to regular activities. It's maximum relief with minimum invasion.
Finally, Part 5, the Awake Surgery Revolution. We are completely rethinking anesthesia. You guys, this might literally be the most profound, game-changing innovation in modern geriatric spine care. Awake spine surgery. It uses local anesthesia and conscious sedation. Why does this matter so much? Because being put under with general endotracheal anesthesia creates intense physiological stress. By keeping the patient technically awake and comfortably sedated, we completely eliminate the massive cognitive and cardiovascular risks of general anesthesia. It makes the surgery vastly safer for older hearts and brains. And the best part is how it all fits into a whole picture approach to patient care. Step 1 is prehabilitation, optimizing nutrition and physical training for a few weeks before surgery. Step 2 is the awake or endoscopic surgery itself. And Step 3 is the ERS protocol, enhanced recovery after surgery, which safely gets patients up and moving within 6 to 24 hours. Modern medicine literally supports you every single step of the way. So if you or a loved one are suffering and have been told you're too old for surgery, well, it might be time for a second opinion with a modern specialist. You can call 602-833-2141 to schedule a consultation and explore these life-changing options with Dr. T and the team.
I want to leave you with this final empowering thought. The research is completely clear. It's the biological engine that counts, not the years on the calendar. So if your biological age is what truly matters, why on earth let a simple number hold you back from regaining your mobility and reclaiming your life? Thanks so much for joining me for this explainer, and we'll catch you next time.